right, welcome back to another episode of the Wilderness Physical Therapy Podcast. Today we have Trevor Soik. Did I say that correctly?
You did, yeah.
We've got Trevor here on the horn. Him and I are going to be doing monthly podcasts together, looking at research and other topics about physical therapy and hopping on and talking about it together. So Trevor's out in Washington State. He's got a business called Bridge the Gap Physical Therapy, where he helps barbell athletes get back to lifting heavy things without pain. Is that right?
That is right. Yeah, because lifting heavy things is cool.
That's right. You got to do it. You got to do it. So today the topic is about saunas, and diving into the research, I really wasn't sure what we were going to find or what there is to find on saunas. I'm not a huge sauna guy myself. I personally hate the heat like that. It just feels musty in there, even though it's they have it dry, but I don't know. I just don't like the feeling of being inside one. But I had a family friend ask, he's the one who sparked the topic. I had a family friend ask my opinion about saunas and infrared saunas. And I was like, I really don't know that much about it, but I will find out. And that's now been 2 months ago. So clearly life has taken over, but Trevor and I dove into some articles, and we're going to talk a little bit about what we found as far as the health benefits, low back pain, cardiovascular function, blood pressure, and the gut, the effects on the gut. So Trevor, what were your initial thoughts? Let's go the gut one. I didn't read that article, so let's talk about that one real quick, and then we'll end with the cardio one since we both read those.
Yeah, and the cardio significance, I think, was a lot bigger.
Yep.
But first things first, like first impressions, let's start at the beginning. Yeah, I'm one of those guys where I tend to think these types of modalities are like either like neutral or like kind of beneficial, where it's like, you're probably not going to hurt yourself if you like going into a sauna or a cold bath, which is kind of trendy now. I tend to be one of those people where, do as you please. It's probably not going to make or break your recovery, but this type of stuff actually challenged my biases quite a bit, and that's a good thing. But anyway, so if we're looking at like the GI stuff here, which honestly I don't know a ton about gastrointestinal health.
For PTs, not internal.
Yeah, that's kind of my thing. It's one of those like, yeah, we should probably talk about it with somebody else who's a better expert than I am. But generally speaking, it didn't seem like there was a huge difference between people who were exercising 3 times per week and then saunaing afterwards compared to those who just exercised. So it didn't really seem to make a huge difference, but it also didn't have any really negative effects on people.
Huge difference on what? What was the study looking at?
They're looking at the intestinal barrier function to see more or less how your GI how your immune system is altered during intense exercise and with the addition of sauna after the intense exercise. But more or less, there's kind of like a neutral finding between people who actually did this 30-minute high-intensity exercise 3 times per week with a 15-minute sauna afterwards compared to people who did the same training program without sauna. And yeah, honestly, it seems like it's kind of neutral versus it's kind of, how do I want to say that? The findings were neutral, potentially a little bit beneficial, but it didn't really seem to be make or break in terms of health. It's not like doing a bunch of exercise and then doing the sauna is going to drastically improve your immune function or your gut health.
Did it look at metabolism at all? Like someone's metabolism hopping in the sauna after working out? Sauna?
Not exactly.
Function.
Yeah, it looked at more or less what they really tried to look at here was the gut health, the anaerobic bacteria here, they call them, and these words are like 15 letters long. It's like they're looking at like the actual gut microbes and how they were permeating the gastrointestinal wall here. So half of it, I'm like, man, this is really, really, really deep. And then the end conclusion is kind of like, yeah, it didn't seem to make a huge difference. But in terms of metabolism, they didn't really check that specifically. Like they weren't looking at like calorie count. There was a little bit on body mass, which, all the body mass changes just seem to be from fluid loss, which makes sense because you're sweating your balls off.
Right.
I think also with the study, it was like 90 degrees Celsius, which is, I'm pretty sure is something like 160 degrees, 140, maybe
look at that. So that's a good segue into Finnish sauna is
super cool.
It's the between 90 and 91 degrees Celsius at 14 to 16% relative humidity. The Waon therapy, I think I'm saying that correctly. That is infrared sauna at 60 degrees Celsius. So there's a difference. Like it's just not as hot. We'll dive deeper into the dosing and the temperature differences later on with the cardiovascular stuff, with the blood pressure and all that, because that definitely played a difference. But yeah, just so the listeners know, like those are the two different sauna types that were in the studies, was the 90 to 91 degrees Celsius and then the 60 degrees Celsius. So sorry, I need to plug that in because always.
No, that's important. And even 60 degrees Celsius is pretty dang warm. Like,
yeah.
Actually, yeah, if you get a conversion, I mean, I'm pretty sure 90 degrees, like you're cooking. That's hot.
Holy, yeah, 60 degrees Celsius is 140 degrees Fahrenheit. 90 degrees Celsius is 194 degrees Fahrenheit.
I guess I didn't realize it was that hot. That's almost boiling.
I did not know that either.
There's a reason getting ahead of ourselves. There's a reason that the Finnish sauna is only 15 minutes long.
Right.
Like you probably physically can't go longer than that.
Right. And that kind of leads into a low back pain one first. I'll
do toss that
in. That. So this particular study looked at 90 degrees Celsius sauna, so 194 degrees Fahrenheit for 15 minutes. It was 10 sessions over the course of 1 week. So it's 2 sessions a day where they would go in for 15 minutes, come out for 30 to room temperature, go back in for 15 and come out for 30. And then they do the reassessment after the second 30-minute rest break. In the verbal scale, as far as pain, the participants initially rated it at a 5 out of 10 for low back pain. These participants didn't have any pain going down the leg. It was just central low back pain staying in their back. Originally, they rated it at 5. After the 1 week sauna treatment, their scores dropped down to 3, which is pretty significant considering that all you're doing is going into a sauna. Like you're not exercising, you're not moving, you're not thinking, you just go sit in a sauna. So a 2-point reduction on a 10-point scale is pretty significant. And then the Oswestry Disability Index, so that's just a measure of function. It asks about picking things up, sleeping, general movement. And the lower the score on that one, the better. And so the participants initially at the beginning of the study had a score of 12. And then after the 1 week, they had a score of 8. So again, a drop in 4 points, which is pretty significant when you're not doing anything. As far as someone with low back pain, it's definitely it's opened up my eyes to the possibility of suggesting someone utilizing a sauna to help reduce their low back pain. Like if they are going to the gym, they have a gym membership and there's a sauna there, might not be a bad idea to, once they're done doing their exercises, hitting up the sauna once they're done, help get that short-term reduction in low back pain, especially to reduce any sort of soreness.
That's pretty awesome too. I mean, that's a pretty quick turnaround for pretty low effort.
Right. And that was one thing that the study that these guys pointed out was like sauna therapy, whether it's the Finnish or the Waon, like it's no effort on the patient's part. Like you just walk into the sauna for 15 minutes. I think the dosing, it may be different for the cardio, but it seems the general dosing for health benefits was twice a week for 15 minutes. So if you can't go in it every day, that's still okay. But if you can have a sauna twice a week for 15 minutes after your workouts, I think that'd be a good way to cool down per se after your workout.
Zoink.
Right?
Got them.
Why don't we head over to the cardio benefits now, the blood pressure, because there was a handful of studies that talked about that stuff. I guess questions about the low back real quick before I head over.
Did they do anything else for low back pain, or was this like their sole treatment option for that week period of time?
This was it. I believe they split them up. Like they were in the hospital, I think, for the week. The exclusion criteria was previous injection within a month or previous PT within a month. So they weren't even doing any of those. So they just really wanted to concentrate on the sole effects of hopping in a sauna for 15 minutes.
I like that. All right. I mean, that could even be used if you had somebody who had some pretty intense pain and, if you're at that stage of like, hey, kind of everything hurts and I don't really feel comfortable moving. If that's even like your first step in treatment, like, hey, over the course of the next week, just hit the sauna for 15 minutes.
Yep.
Then we'll start to reintroduce some motion.
Right.
Just to make it a little bit actionable.
If you can walk your butt into a sauna, like you can possibly see a reduction in pain. So who wouldn't want to do that if you're sitting there in agonizing pain?
Take care of the low-hanging fruit first.
Right.
But yeah, that is actually another segue into like the cardiovascular benefits. So if you want to even expand on just the back pain aspect of things, which conveniently affects a lot of people, this I thought was crazy interesting. I thought it was super interesting to see the blood pressure changes, the cardiovascular changes, and the legitimate health changes that come from the frequent sauna exposure. The study I've read actually came from Finland, so right from the source. So what they were doing was they were actually trying to find a dose response between cardiovascular health outcomes long term and how often and how frequent sauna exposure is done. The coolest thing to me that I found was kind of twofold. Number one, they found a dose response. Literally, they found that if you expose yourself to that Finnish style sauna more often, you actually have a reduced risk of future cardiovascular disease and myocardial infarction within like a 10-year window.
What's a myocardial infarction?
Heart attack. So basically, over the course of 10 years, significantly reduced risk for heart disease and heart attacks over the course of 10 years. And they found it seriously, like these benefits were found with frequency as low as once per week for 15 minutes. And I believe they categorized it into you were in one risk factor or one category. If you were bathing once or twice per week, 2 to 4 times per week, your risk reduced even further. And then if you did something like 5 to 7 times per week, your risk was reduced even further than that. So like there was a dose response, and it was quite literally like more was better. And they even proposed in this paper at the end of it that based on your sauna exposure to, or your exposure to a Finnish style sauna, should actually be an independent factor in determining your risk for cardiovascular disease. Other things included like your genetics, your smoking history, other health history. Like sauna exposure, they proposed should just be its own factor. Like that's how powerful it was. That blew my mind.
So with the Finnish sauna, it definitely reduced the diastolic blood pressure in all the participants. So diastolic blood pressure is the blood pressure in which is in the body when the heart is not contracting. So if you have a very high diastolic pressure, there's something going on in your venous system or the artery system that the heart really has to pump against that, even though it's not contracting, which is not good. Yeah. So it's pretty common to see like direct exercise, caffeine, that sort of stuff directly affects the systolic blood pressure. Diastolic blood pressure, I think, is a little harder to change, in my opinion. So if you have a high diastolic blood pressure, like that is a bit of an eye opener. So the fact that in the sauna for 15 minutes, the Finnish sauna for 15 minutes reduced that for all the participants, and the studies that I saw was like, that's phenomenal. And it was a significant drop, anywhere from like 5 to 8 points. So again, that's a pretty significant drop for not doing anything. All you're doing is going to sit in a sauna for 15 minutes.
You're just chilling.
There was a decrease in systolic blood pressure. So systolic blood pressure is when the heart is contracting, when the heart is pumping. What is the pressure throughout the artery system? I saw that folks who are newer to using a sauna saw greater benefits in that. Everybody saw benefits, but folks who were newer to using a sauna within, like they had never used it before or had been using it less than a year, saw greater benefits. And cardiac output is actually increased when you're in a sauna. So that's good, and you need to be mindful of that. So if you're in a sauna, it would be good to be wearing either know how to check your heart rate or be wearing a heart rate monitor, because it looked like getting above 140 beats per minute showed to have adverse consequences. But if you got up to about 120 beats per minute, that showed to be beneficial, which makes sense for quite a few people because you're getting into that zone 1, zone 2 heart rate zone. So that's the aerobic heart rate zone for most folks. That's going to be an okay heart rate zone to be in, but you start getting up above 140, then you have to be mindful of that. With that, like the longer that you stay in the sauna, up to 30 minutes, started to show some of the cardiac stress with the heart rate getting up that high. The Waon therapy, that's the lower intensity sauna as far as the temperature goes. So they really didn't have issues with increase in cardiac. There was an increase in cardiac output, but they weren't concerned with the heart rate getting too high if you stayed in there longer than 15 minutes. It was suggested that folks with chronic heart failure hop in the sauna because it's stressing the cardiovascular system, but you're not exercising, right? You're also getting some of that fluid to get out of you because you're sweating. And it looked like twice a week for people who, like you and me, outpatients, where we're not staying in the hospital twice a week, was all they had to do for 15 minutes.
Yeah. And I think that jumps right off of kind of the study that I read, like these huge cardiovascular improvements. And it's like, again, all you're doing is sitting in a sauna for 15 minutes at a time, anywhere from 1 to 7 times a week. And I'm glad you commented too, like on the diastolic pressure, because I think we focus a lot, and glad you defined it too. Like the diastolic is what happens when your arteries are relaxing. So if your arteries are harder or stiffer, your diastolic pressure is higher. So what these saunas have showed is they actually improve the elasticity of your arteries. That's a good thing. You want elastic, kind of gooey arteries, so to speak.
Yep.
And if I remember right, I think in a lot of cases, like we look at like that top number a lot of times for our blood pressure, but Rob, you commented on it, like the real eye opener is that bottom number, because that's where we're looking at like that stiffness or that hardness or lack of elasticity. And if I remember right, I think a lot of times, like truly like the effects of like high blood pressure or risks for heart attack, that's really the number that we're concerned with. Like if you're systolic, your top number is healthy, let's just say it's 120, but your diastolic, that lower number is, let's say it's 100, that's not healthy, that's not normal. That means that your arteries are still quite rigid. So the fact that this sauna bathing is decreasing that bottom number on your blood pressure is huge. And like you said, like what was it? It went down something like 5 to 8 points on average, regardless of age or weight or sex or anything. It was just pretty much, I'm pretty sure it was across the board. Everybody's diastolic went down. I think the systolic was a little bit variable, if I remember right.
Yep.
But the diastolic pretty much across the board.
Yep. So kind of wrapping this up, clinical bottom line. Tell me your clinical bottom line. Would you use it? Would you not? Would you recommend it? Would you not? What are you thinking?
I would absolutely use it. I would get a consult from a physician if you have any kind of medical contraindications, like if you have congestive heart failure, if you've had a past history of a heart attack. I would check that out first, just to make sure that you're healthy enough to tolerate that persistent 120 beats to 140 beats per minute of cardiac output. But absolutely, I mean, at this point, there's not really any reason not to, especially if you're sticking to smart guidelines and doing it for short bouts at a time.
I think talk with a physician. If you have any sort of heart issues or any concerns, talk to them first to see if they're okay with it. Hop in there for 5 minutes. If that's all you can tolerate, hop in there for 5 minutes and slowly build your way up to 15 minutes. You don't have to go for 15 right away. Everything's a tolerance.
I agree with that.
If your heart rate does not get up to 120, totally okay. Most of these studies, the participants' heart rates did not get up to 120. It was around 100 beats per minute. So there was an increase in resting heart rate. It just wasn't to 120. According to the research, if you have heart failure or anything like that, maybe start off with the Waon therapy. We're at 145 degrees Fahrenheit for 5 or 10 minutes and work your way up to 15. But yeah, definitely something else to use for cardio benefits and low back pain. Right on. Well, thanks for hopping on.
Of course. Thanks for having me.
Yeah, of course. We'll have to do this again next month.